Here we go. Hello there. My name is Lynn Jocelyn. I'm a functional medicine physician assistant, and my mission is to empower people to optimize health through a functional medicine and a colorful approach. And a big part of what is really important to me is supporting people to harness the healing power in community. And so this is both with my patients, as well as other practitioners who are in different healing spaces. So I'm having these conversations with all sorts of different practitioners to bring us together, as well as to offer our gifts out there to the people that we're working with. So I'm really excited to have Marquelle Brown back again. In the first conversation, Marquelle and I talked a lot about her practice in supporting people with nutrition. And that is just way too simple of what Marquelle does because it's so layered. So if you didn't get a chance to hear the first conversation, please go back because her approach to healing is just, there's a lot of depth. And so she also does and is exploring neuro-linguistics programming as well as timeline therapy. And so I was so excited about this and to learn more myself that I asked Marquelle if she would join me again. And here we are. So Marquelle, if you want to just share a bit about that piece of your practice and introduce yourself again as well. So.
Okay. Yeah, thank you, Lynn. It's a pleasure to be here with you. And I'm a functional nutritionist, and I specialize in gut health and autoimmune conditions. And I really like to help people to be able to achieve their goals and their health goals and experience the joy of wellness and improve their quality of life so that they can do the things they want and find that joy that they're searching for. So one of the tools that I have been trained in, I did the Master Practitioner Trainer training last May, and it's for neuro-linguistic programming and timeline therapy. And it's a very exciting modality. And it's a process where we can release negative emotions attached to past events. So it eliminates self-limiting beliefs that hinder a person from pursuing the life that they want. We take away the negative emotions attached to the past events, and they keep the memory of the events. So like if the next time a situation that would normally make them feel bad arises, they'll be able to deal with it intellectually rather than base their reactions on how they felt towards a similar event in the past, which is really nice. So it's one thing that I really like is that we, can keep the memories, we learn from what happened. We don't have the negative emotional charge that is triggering. Some people have a lot of anxiety, PTSD, and so we're removing those filters that are contributing to those negative emotions, which when we think about our mind, we have our conscious mind, which is our thinking brain, where we make choices. It's where we have our free will, our decisions are based from the conscious mind. And then we have the subconscious mind, and that is where our emotions and beliefs are. So if we think emotion, energy in motion, right? And this is also where our habits are stored, our self-images, self-concept resides. It's really kind of our core beliefs. And so when we are wanting to shift things, we are needing to access, those emotions. Okay. And so we know consciously, we choose our thoughts, and those thoughts are, creating feelings, and the feelings, they produce results. So, if we want to change those results, we need to change what's going on in that emotional mind. So it's pretty exciting. I'm going to just go over like what NLP is. Neuro-Linguistic programming is often referred to as NLP.
Okay.
So the N is for neuro. So we've got the mind and the brain. So the mind is the nervous system through which our experience is processing the five senses. So, we all respond differently to visual, auditory, kinesthetic, olfactory, gustatory, which is taste. Taste isn't referred to very often. That is one of our five senses. And it can correlate with the emotions that we are feeling because it's one of our senses, and that's coordinating with the nervous system. Mm-hmm. So we know linguistic is language. So with linguistic being language and other nonverbal communication systems through which our neural representations are coded. So what that means is our mind is kind of like a hologram, and it's different than a visual. It's a representation of something. So we have things that we relate to, like pictures or sounds, feelings, tastes, smells, self-talk, gestures. All of these things are representations of words that we put with those representations.
Okay.
And then the programming is the ability to discover and utilize these programs or holograms that we run in our mind, in our neurological system, to achieve our specific and desired outcomes. So, in a nutshell, NLP is how to use the language of the mind to consistently achieve our specific and desired outcomes. So one of the Yeah, it is pretty exciting, isn't it? Yeah. So one of the things that we're all familiar with are strategies, habits, routines, and that is actually correlated with the unconscious mind. And the mind works very well with strategies. So if we are trying to change a pattern or a behavior, we want to have a good strategy in place. And that's where those routines and habits are so important, because we're instilling that into the unconscious mind. And we know that if we can do something for 28 days, it's going to become a habit. And so, so one of the things, if people do have anxiety, for example, is if they can create some strategies and routines. So like if they become anxious for whatever reason, that they have some strategies in place that they can go to. So whether that be, going for a walk, or going and petting the animals, or playing music, or drawing a picture, journal writing, all of those things are going to help redirect the mind to what we want to do. And it helps us to be able to remember our values and our beliefs, and so when I say what we wanted to do, what our goal was.
Right, the outcome. Mm-hmm.
Yes. Yeah. So also with the unconscious mind, that's what stores our memories. So now a lot of times we may have things that bother us and we're not exactly sure when those happened, but they are there. The mind also organizes our memories. It runs our body. So we don't have to think about our heart beating, right? And actually, when we think runs the body, we can even get into such a habit and routine. If you're going to drive to work or drive to the grocery store, I mean, sometimes we're like, well, how did I even get here? Right?
Absolutely. I've had that. It's a little bit scary when that happens, but those autopilot routines.
It is. And so we're grateful for those, for the power of the mind that can do that. The auto routines, as you said, It also helps to keep us safe, because the unconscious mind can often detect danger, before we're even consciously quite aware of it. And so that's why we startle or we jerk and things like that. So those things are all good. Now they're good, except for when they get in a loop and where they're no longer serving us. So, and that we see a lot with trauma, accidents, betrayal, even sometimes if somebody was exposed to something like an illness, there might be some trauma along with the lines with that. And so then we have these unconscious programs that in the moment they were serving to us, and then they no longer serve us and they become roadblocks, is what I describe them as. So one thing that's really great with these tools that we use with neuro-linguistic programming is we are helping to basically, we gather learnings from those experiences and we use the timeline. So and the person is totally in control of everything that's going on. And we use language in that the mind will often delete, distort, or generalize things as well. And so obviously, if we had a trauma at one point and we recovered and we're well, yet we're still having traumatic experiences, that's the mind that has, deleted, it's distorted it. Or we know people that have had traumatic experiences and they can't even remember it, right? Yet they're still having other symptoms going on. And so we are, helping to elicit those memories and gather the learnings. Oftentimes, it's just that there's something more to be learned from that experience, and acknowledging what happened. Really, in this process, people don't have to tell very much of their story. They're thinking about it, and people do share, and that's fine too. And it's just, being validated and acknowledged. And as the practitioner, as I'm, walking them through this process and they're gathering the learnings, then we use tonality to be like, yeah, that's right. Now that they've, yeah, that was really hard and painful at this time. And now I'm okay and I'm safe and everything's good. And, whatever the client comes up in their own words from their own experience. And, we'll give reassuring comments back to help anchor that in, to help them reassure them that, yeah, that's right. That's where we are now. And then when we are working on finishing that, we come back along the timeline and they're just visualizing their timeline. They go back into the past and then and remembering the moment. And then we visualize coming back and it clears all the negative emotions. And then what we do is we call it future pace. So we're going to make sure that we've cleared all of the negative emotions. So we have them go back again and make sure that they're not feeling anything there. And if they do, then we will go back and do it again. And then once those are clear, then we just have them, visualize going out into the future and then looking back and seeing if they could feel those same feelings if that situation were to happen again or something similar to it. And so we're making sure that all of that is cleared. And the other great thing, again, that I like about it is you get to keep the memories. Memories are helpful. So we don't want to get rid of them because those actually can be helpful. It's just that we don't need the negative emotions that are no longer going to serve us. Actually, that are no longer serving us.
Right. Because so is it when we experience things that are looping like that and it's, it's removed from the trauma and those negative emotions come from, is it, so we're reacting not even really to the memory, we're reacting to the emotion, right? Or is that
right? Well, because it creates a chemical release in our body.
Yes.
And that's when we're flooded, and then, it just kind of keeps the body in that spin because we're flooded with all of those chemicals. So yes.
It makes so much sense. And so how can you describe like how you work with somebody? Is this, I know you shared a bit last time with
Mhm.
me. Sometimes you'll do like a 6-hour session. Maybe I don't know if I remember that correctly.
Right. Yeah.
Break them up. What does it look like for somebody?
Yeah. So
Situation.
that's a great question. Yes, there is a short breakthrough session, which is 6 hours together. Usually we'll work for 2 or 3 hours and then have a break, and then we'll come back and finish that. Or we could do 2 or 3 hours one day, and then we can come back the next day
So they need
and
to
finish that.
like pretty close together, right? You couldn't do 3 hours one week and then 3 the next, or is that?
It's probably for that one, it's probably best to do it closer.
Mhm.
For a longer breakthrough session, we can come back. We're going to do more of that first session, and then oftentimes we'll send home some homework, like with some strategies for them to kind of reinforce what we worked on and what we were clearing. And then we'll come back and we'll do some more. Yes. And, if a person gets to the point where they're like, okay, I think that I'm good for the day, we can come back the next day. Most of the time, though, again, like I said, the negative charge is gone, and so people feel better. The thing that I noticed with myself, yes, is that this is very, we're going right to the root, and it is, we're clearing it. And there was not, like some of the other energy modalities that I've used, I've had like this residual, like I just felt off, until I kind of got back into sync. I did not experience that with any of the NLP that I did. Some of the things that I did experience were better communication with my family members, which was exciting, and more communication. Somebody that was normally not very talkative, they were very talkative, and it just was easier to interact with others. So
This is
for
after
me,
you did it. And then other
yes.
people, you notice the change. Isn't that's just to me is so, it's so cool. We're just all connected. So go ahead. Sorry. I
Right.
got
No, it's so exciting because it is that ripple effect. And, a lot of times people, I've heard people say, you've got to change yourself. And I'm like, but if they would just change. So when I did 2 parts of this training. In the first part, my husband is not a big phone talker, and we talked on the phone, and he talked for a long time. I think we talked for like an hour. So for maybe getting a good 5 or 10 minutes, an hour is a long time. And I said, I have to go. And he's like, well, can I call you back? And I'm like, sure. And then he called and talked to my daughter. And then I came back and we talked again. And my daughter called me. She's like, what is going on? He talked to me for a long time. So it even riffled out so that she noticed that there was this shift. So how energetically that works, I'm not quite sure, but we are all interconnected. And energetically, when we remove filters, it's going to be freeing not only for ourselves, but others around us. And we may see that manifested in different ways. That was one way that I saw it. And it was fun.
that is awesome. Yeah. And how long does this, do you ever work with people and they clear it and then it gets something re-triggers the same event? Or is it pretty good? Like for the most part, people, whatever they clear, they do it fully, they're done kind of thing?
Yes. And then usually I find that there's just another problem.
Okay.
So there's something else that came up, but it's just another problem.
Okay. It's a separate incident or okay, not a
right. Which is exciting.
Yeah, it's really, I mean, and we said this the last time, I think if we could, for so many things with healing, with chronic illness, with doing the more physical work with people, like working in this realm first, clearing stuff, I think the other work would be so much less intensive. I don't know, but that's just my sense, as we hold so much of that in our body, past triggers and things and traumas.
Absolutely. And we know the book Body Keeps the Score.
Yeah.
And if you can clear those traumas, you can, free up the body from symptoms. So a lot of times when we are having physical symptoms, it's trying to alert us that there's something else going on, emotionally, mentally, spiritually. And, and I do know, there are things like environmental exposures and things like that. And, that might be a little bit different than, say, like a trauma, because a lot of autoimmune conditions, you can often trace it back to a trauma. And, so again, if you can address the traumas, it's going to help, get rid of that stuff that's stored, the emotions, the feelings, the thoughts, sensations. And that's going to reduce stress on the system, because it's no longer having to try to figure it out and process it. I kind of have been thinking of traumas almost like bondage, because the body is still just trying to work through it and figure it out. And, once you can work through the trauma, get some tools to help, recover, and that the body is going to do a lot more. So it's almost like we are removing inflammation, just on a different frequency and level, if you know what I mean.
Yeah, no, that's it's, yeah. And when you were saying that, I just felt like a freedom for the body to do what it knows to do. And it's less
Right.
it can get back to balance, because it's always trying to get back to balance, right? No matter what.
Absolutely. Yes.
Blocks that you describe that kind of slow the process.
Right. Right. And also, I like to, like, limiting beliefs or traumas, I like to think of them as like filters. So like if you're looking at a light and, I'm here and the light's over there, and you've got all these filters in between, you're not going to be able to see that light very clearly. And as you remove the filters or the roadblocks, obstacles with these emotions and traumas and limiting perceptions even, then we can see clearer. And it really does just take a whole load off, a burden off, and is very freeing. So I would say it's too good to be true, yet I had been struggling with some PTSD for quite a few years. And I would actually never wish that on my worst enemy, because it just never stops. It's just like constant noise in your head. And then, if there's something that triggers you, it just adds to it and makes it worse. And, although I don't think anybody knew, unless I had told them, but it was just always there. And it's very hard to navigate through your day with the constant noise. And so I've done different energy work over the years, and I was using that and, therapy and all of these things. And I'm like, and I already had the nutrition going, which was huge as well. And I was like, there has to be something, because this is horrible. And of course, everything that I was using was helpful. It just didn't take it away. I just wanted my mind to be quiet. And so, it is a good thing I can laugh about it now. It really was pretty horrible and very weighted. And
like you feel that.
Say that again.
You have that quiet space now. The noise is gone.
It is.
Wow.
And it's such a blessing. It's so wonderful, because I can just listen and there's nothing there. There's nothing spinning, ruminating over and over. It really was horrible. So I was really excited with the first training that I did. It totally cleared it. I was like, yes. Now, do I get triggered here and there? Yes, but it doesn't throw me totally into PTSD that's like just never ending. I can get triggered, and because life is going to have its bumps and its challenges. It's just that I can work through it, and my mind won't just be spinning over and over, but I can work through it in a couple of hours with my tools that I have, or less. I'm just saying, like, if it's something big, I can use my tools, and it will help me to get back to a zero where I'm, clear headed. And so that was really great. Now, I had an injury along with the initial trauma, and it was mostly gone, but it was still there. There was just still some layers. And I still had to be careful. So I was still, if I overexerted myself, I'd have to sit down, and then I couldn't do anything for a few days. And so that was still really bothersome. So after my second training, and I probably did know which one cleared it. I don't remember now. But all I know is that after I came back home, I was cleaning and picking things up and just going about my way. And I was like, oh my goodness. Okay, is it really gone? Am I going to be okay? I was so excited because it would be that one pain, which, kind of also really emphasized to me of the body keeps the score, and how those emotions are behind that and the traumas. And I didn't have the pain. I didn't tense up more and more because of the pain. And so that also made me really happy, because that really was interfering, maybe even more so than the PTSD, with what I was doing, because I would be physically limited.
Right.
So, and there were other things that I saw, and were very, very helpful, which, so I'm excited to share, this technique with other people that are, they have a big problem that they've tried, and they keep trying to overcome it. And for whatever reason, they just always, drop the ball. It just doesn't happen. And helping them to be able to go from point A to point B. And by clearing that negative information and emotions that's no longer serving them. And it's very exciting.
So exciting. And so are you integrating this with your nutrition, or is this separate, or like, how are you bringing this to people, and how can people find you for it?
Yes. So I do it separately.
Okay.
I am working on educating my clients, and I would like to also bring that in as well, because I really think that this is a big missing piece for those that have chronic issues. I work with a lot of, gut issues, autoimmune, and I really think that this is one of the pieces of the puzzle that's going to help them to go further faster and be able to break through those things that are holding them back. And of course, using the nutrition is going to be very helpful for supporting. Yet there are people that do this and they don't do the nutrition, and they're getting great results. So I just am the nutritionist, and I like to also, if they're willing, we'll do that. And if not, then it's really great that we can use this and still get excellent results.
It's amazing. And so I know we're getting close to time here, so I want to be respectful, but one other question that comes up: what if you're working with somebody and they're not, like, they don't know what they know there's been something just based on how things are manifesting through their body, but they don't know, like, the one event. Is it, can you help people get there? Can it be,
yes,
fuzzy or hazy because of our memories, right? They can be that way. What does that look like?
Absolutely. So we do something called discovering the root cause, and we actually go through 5 emotions. And we can just do this one alone and not do the breakthrough session. And it usually takes, 2 to 3 hours, depending on how much the person talks and shares what they're learning. And what we do is we ask, so what is the root cause of the problem? The first event, which when disconnected will cause the problem to disappear. So if they don't know the exact time, then we ask, was it from 0 to 7, 7 to 14, 14 to 21? And then we ask, like, if you were to know, was it before? So before you were born, was it in the womb? Was it past life, genealogical, and whatever that means for each individual, because each individual is going to have their own interpretation of that, and there's no right or wrong answer. And that is, so that's how we can help go into that time frame if we don't know exactly. Because if something happened when you're a baby, your memories and younger, and so and when we ask, okay, if you were to know, if you did know, that's going to help just really go in and be like, oh, okay, this time. And then we go from there. And that is very helpful, because a lot of times people don't know exactly.
Right.
And then it's cool. It's a cool process, because when they do go into that, they are still able to gather learnings and share what those are. And they still clear that. So, just accessing, just calling it, we're kind of like a computer. So we're asking the questions and they're calling it up. And then whatever comes to their mind, just trust that and go with that.
Whatever comes up is supposed to come up at this point. And
right.
Do you do these virtually as well?
Yes, I do.
Oh, exciting. Okay.
Yeah.
Well, I know, I just want to be conscious of time, because I know, time constraints. So I will put where we can find you for this, Marquelle, and I've already got like, oh, this person. So you and I will connect. I'm super curious just to learn more, so I can share this with the people I'm working with, family members, things like that, because it sounds really quite profound. And it really sounds like maybe it's the kind of thing where experiencing it as you did, really helpful, because it does sound too good to be true. You know what I mean? It's just
it does,
to get rid of this, and like you had said, therapy and food and this, and that, and and I'm sure all those things help align your body to receive this, perhaps. But so anyway, super excited. And the other,
I'd like to do one more thing, if that's okay. Yeah. So, and this is just a really quick anxiety model. And if you can think of an event where you were feeling anxious, so go ahead and just think about it. And then I want you to think of which direction is the past, and it could be right or left, or in front or behind or above or below you. And then think of which way is the future. And knowing that right here is the now. And I want you to just go up above that timeline into the past and right over that event where you felt that feeling. And nod your head when you're there. All right, good. All right, and now I'm going to have you float up above your timeline. Out. Actually, I'm going to have you go float back up over that position. And I want you to just notice those feelings and emotions, and notice where you feel it in your body. And maybe what you're hearing, if you smell anything. And then I want you to think about what you would like to feel. And how that's going to be different, and how you're going to just really enjoy that new feeling. And then you're going to go up on your timeline again, out into the future, 15 minutes past that event, and even further out, 5 years past that event, and look back and see what you feel now. You can feel those feelings that you would rather have, that you wanted, and that you know you have now. And then come back on your timeline, back to now, knowing that you've cleared all of those negative emotions. And take a deep breath. And when you're ready, open your eyes. And if you think about that situation now, has anything shifted? You still feel those old emotions?
Definitely feel less.
Good.
It's interesting because I wonder if it's like, and this was one of the questions I had when I was listening to you, but after going through this, does your brain try to search for the old way for a minute, or like
it can, and
or it feels different, or?
And this is a really like a fast one,
right.
and we may need to do just a little bit more, go a little bit deeper with that, with the different emotions, so that we're covering all of them. You know, the anger, sadness, fear, hurt, guilt.
Mm-hmm.
So that is good. That it's less, and you can do that one again on your own, and see what you notice, and see if there's anything that you need to learn from that. And then go back up into the future, and then you can look back and see if it clears some more. So you could do that one a few times on your own.
So you go to the event, above it, and then you 15 minutes past it. So 15 minutes into the future from that event, right? Like
yes,
closer, closer, you go way out, and then you come back. Okay.
Yeah.
Okay. Yeah.
So very exciting.
That's so cool. And I can only imagine even the short breakout session, the 2 hours, of how profound, and you gather the learnings as you use that terminology. And so, wow. Well, I even got a little extra with it. So Marquelle, thank you so much. And yeah, I'm really excited about what you're doing. And I agree with you. I really think this is the next elevation for so many people struggling with so much chronic illnesses and things, autoimmune, all of that. So thank you for expanding and always kind of looking for better ways to approach supporting people and healing yourself, because then that allows you to be in the practitioner healer role. So
yeah. Well, thank you. And it's been a pleasure. Thank you for having me again.
Oh, it's so fun. I will, I'm sure I will pick your brain periodically.
Yes.
And I'm looking forward to joining the whole detox with Dr. Minnick is coming up in March. So
yes,
anybody's listening, I will be posting about that too and joining. And I think Marquelle may be doing it too. So
I am. It's wonderful. So it's quite an amazing experience, doing little things each day, and it creates a big change. It's so amazing how that works.
It is. Well, thank you so much for spending another bit of time with me, and I will get this uploaded and send you a copy, and hope that the listeners learned more. And if you are curious in how to find Marquelle, that will be all written in the description with the podcast. So we'll
Great.
see you next time.
All right. Thank you. Bye-bye.
Okay, bye-bye.